One shocking fruit that can naturally shrink an enlarged prostate, BPH. Are you constantly waking up at night to urinate? Do you feel pressure in your lower abdomen, struggle to empty your bladder, or find yourself always searching for the nearest bathroom? These symptoms may be signs of benign prostatic hyperplasia, BPH, a common condition affecting millions of men, especially over the age of 40. But what if I told you that relief could be hiding in your fruit bowl? As a doctor, I've spent years researching natural methods to manage prostate health, and today I want to share with you one scientifically supported fruit that has been shown to provide real relief from BPH symptoms. In this full guide, I'll walk you through what BPH is and why it happens, the shocking fruit that may improve your prostate health, how this fruit works in the body, how to incorporate it into your routine, what foods you should avoid, the benefits and side effects you need to know. Let's begin your journey toward a healthier, more comfortable life. What is BPH, benign prostatic hyperplasia? BPH is a non-cancerous enlargement of the prostate gland. The prostate is a small gland located just below the bladder and in front of the rectum. As men age, the prostate naturally grows. In some men, this growth becomes excessive, causing pressure on the urethra and bladder. Common symptoms of BPH include frequent urination, especially at night, nocturia, difficulty starting urination, weak or interrupted stream, feeling that the bladder hasn't fully emptied, pain or discomfort during urination. BPH is not life-threatening, but it can seriously impact your quality of life. That's why natural strategies, especially dietary changes, can play a crucial role in managing it. The shocking fruit that can help. Tomato. Yes, the humble tomato. This everyday fruit, yes, it's technically a fruit, contains a powerful antioxidant called lycopene. Numerous studies have linked lycopene to improved prostate health and reduced symptoms of BPH. Why tomatoes? Tomatoes are rich in lycopene, which gives them their red color. Lycopene has been shown to reduce prostate size, lower PSA, prostate-specific antigen levels, combat inflammation in the prostate, improve urinary flow and function. Lycopene is more bioavailable, better absorbed when tomatoes are cooked or consumed with a small amount of healthy fat, like olive oil. Scientific evidence supporting tomatoes for prostate health. A 2003 study in the British Journal of Urology International found that men who consumed 50 g's of tomato sauce daily for 10 weeks had significantly reduced PSA levels and prostate inflammation. In a 2014 meta-analysis, researchers found that men with higher lycopene intake had a 14% lower risk of developing prostate issues, including cancer and BPH. A randomized clinical trial published in Nutrition and Cancer 2008 showed improved urinary symptoms in men who consumed lycopene supplements derived from tomatoes. Clearly, the science is compelling. How to incorporate tomatoes into your daily routine to get the most benefit. Cook your tomatoes. Lycopene becomes more potent when heated. Tomato sauces, soups, or stews are excellent options. Add healthy fats. Combine with olive oil, avocado, or nuts to improve absorption. Daily dosage. Aim for 1/2 to 1 cup of cooked tomato products per day. Simple meal ideas. Morning, whole grain toast with tomato slices and olive oil drizzle. Lunch, tomato-based lentil soup with whole wheat bread. Dinner, whole grain pasta with tomato sauce and sautéed vegetables. Bonus, foods that worsen BPH symptoms. Avoiding certain foods can significantly improve your symptoms. Red meat, high consumption is linked to increased BPH risk. Dairy products can promote inflammation. Alcohol irritates the bladder and increases urgency. Caffeine stimulates the bladder, worsening symptoms. Processed foods, high in sodium and chemicals that can aggravate the prostate. Other prostate-healthy foods to add. Pumpkin seeds, rich in zinc and phytosterols. Salmon and sardines, full of anti-inflammatory omega-3s. Broccoli and Brussels sprouts contain sulforaphane, which may protect against prostate issues. Green tea contains antioxidants that may benefit prostate health. Side effects of tomatoes and lycopene. While tomatoes are generally safe and beneficial, they may cause side effects in certain individuals. Acid reflux/heartburn. Tomatoes are acidic and may trigger symptoms in sensitive individuals. Allergic reactions. Rare but possible, especially in those with nightshade allergies. Medication interactions. Lycopene may interact with some blood thinners or anti-inflammatory drugs. Consult your doctor. Overconsumption, extremely high doses, usually from supplements, can cause nausea or stomach discomfort. Always consume in moderation and consult your healthcare provider if you have pre-existing health conditions. Who's most at risk for BPA? Understanding your risk helps in prevention and management. Men over age 40, risk increases with age. Family history of prostate issues. Obesity and sedentary lifestyle. Or diet low in fruits and vegetables. Smoking or alcohol use. If you fall into any of these categories, a prostate-friendly diet is essential. Doctor's step-by-step eating plan for prostate health. Morning, warm lemon water plus oatmeal with pumpkin seeds. Mid-morning, green tea plus a small handful of walnuts. Lunch, quinoa salad with cooked tomatoes, avocado, and spinach. Snack, a bowl of fresh berries or a banana. Dinner, salmon with tomato broccoli stir-fry plus olive oil dressing. Hydration, drink plenty of water, but avoid after 8 p.m. Stick to this plan for 3-4 weeks and monitor your symptoms. Most men report noticeable improvement in urgency, sleep, and comfort. Final thoughts. BPH doesn't have to dominate your life. You don't have to rely on risky surgeries or long-term medications. Nature offers solutions, and sometimes they're as close as your next grocery run. By adding cooked tomatoes to your daily diet and avoiding trigger foods, you can take proactive, natural steps toward a more comfortable, confident life. Remember, always talk to your healthcare provider before making major dietary changes, especially if you're on medication or have existing health conditions. Watch this video to the end for a deeper dive into the science and practical application, and take back control of your prostate health today. Stay healthy, stay informed, and keep moving forward.